Hello and welcome to Chris 180's Candid Conversation Series. I'm Chandra Luckett, Chief Marketing Officer here and your host for today. Did you know that April is Child Abuse Prevention Month? It's a time when people all over the United States gather to advocate and support those who have been injured or hurt and or traumatized by child abuse. But what happens when the abuse as a child spans into your adulthood? Today, our panelists will shine a light on how trauma impacts us throughout our entire lives and how we can be better advocates for children who have gone through child abuse. Ladies, take it away.
Hi, my name is Kathy Brown Bragg, and I am the project director for our New Generations, which is an infant early childhood mental health service here at Chris 180. Um, I am a licensed clinical social worker and have worked in the field of social services and child serving communities and families for over 25 years.
And I am Janee Embry, the therapist with Chris 180's New Generation program. I have been working with children for maybe 2 to 3 years. This is definitely my first time working with children between the ages of 0 to 5. I've definitely learned a lot about the impact of trauma on their development recently.
And yeah, and when we think about child abuse, I think most people really think about young children. And what I want us to really kind of focus on today is the impact of child abuse over the lifespan. So, for example, we know that young children who are impacted by trauma, particularly child abuse, traumatic experiences, it affects all parts of their lives as they are young children, whether it be in the school, their attachment to adults, caring and healthy relationship development, just kind of overall, it really inhibits them from being able to be their full self until they're able to create and establish really healthy relationships with others.
And to touch on that, I would say it impacts their language. So, how they're learning language, how they're identifying their emotions and their behaviors, and just how they connect to themselves. A lot of times we forget that children who are experiencing different types of abuse can disconnect from their body or disconnect from their peers, their own way of thinking. And yeah.
And so it really, when we think about that, we have to also think about how does the child who has disconnected at such an early age, how do they then begin to move into whether it be pre-adolescent, adolescent, as a young adult, how do they really are able to understand the importance of boundaries and establishing, again, those healthy relationships and making some healthy choices. Because during that adolescent period, they are confronted with so many different issues that most children and adolescents are faced with, which is those choices around, early sexual behaviors, substance use, just dangerous and risky behaviors. So it really impacts on their ability to make those decisions and to know that they have someone who they can really kind of talk to about those kind of like those angst that they may be feeling, but not knowing whether they are a normal kind of angst or and how do they manage those angst.
Yeah. And you mentioned like the school. So I think one of the biggest things as well is having teachers and parent support to recognize the changes in their behavior, to recognize when they are being distant or when they're having tantrums that may last for a longer period than it should normally.
I think, because this is such a heavy topic, I think oftentimes adults, whether they are in a classroom or in the home, really don't know how to identify it, don't know really how to help children. And so through the services that we offer at Chris 180, whether it be New Generations, which really focuses on the young children from, as you mentioned, 0 to not only 5, but up to 12. And then we have our school-based services as well, that we have clinicians that will also be able to help not only the children that they serve, but also help those teachers and those administrators kind of understand those signs and symptoms. Because oftentimes it can be shown in various ways, whether it's a child who's kind of closed off, or a child who's really acting up and having some challenging behaviors. So, through the education that we as therapists can provide, allowing not only teachers and administrators, but also those family members, being able to help them understand that the behaviors that they see, where do they come from, the root of it. And it really is the trauma that they experienced maybe very early on and really had not had anyone to address those experiences in a way that can help them grow and develop healthy.
And I think the beauty with therapy as a whole is that we allow for clients to recognize that healing isn't a linear process. It's not something that, you've experienced this abuse and then you go to a few sessions and then you're perfectly fine. It definitely takes time. It takes having support. You learn, how to set boundaries. You learn healthier coping skills. You are able to find balance in your friendships, your partnerships, and just going into adulthood, your work and your peer relationships, your education, how you're connecting with these different types of backgrounds, and still how you're connecting with yourself. What language you're learning to process your fears, your abuse, how are you navigating through your romantic relationships? I mean, it's a lot.
It is a lot. And I think that, the purpose of really uplifting the whole idea about prevent child abuse and helping people understand that it's not a one-time event, that the event may have been a one-time event, but the actual process in terms of healing, is lifelong.
Yeah.
And that there are so many resources out here for people to take advantage of. But certainly we know that it is not, as you mentioned, it's not a one-time deal. It's something just like so many other issues, and how we grow as a person is ongoing. And so with the support that we try to provide here at CHRIS, it allows people to, at whatever stage of life that they're in, that they can get the support that they need.
And even for those who may not have the community of support, I think one of the things that people can do individually is kind of journal. You can get more into creative expression. You can get more into grounding with nature, just to really identify what your fears are and where they stem from, and how you can build like emotional safety with yourself and with other people.
Absolutely. So I think, again, it's a topic that people are sometimes hesitant to discuss, but we recognize that it is a journey. And so that we here at CHRIS really want to support people as they go through the journey of healing and creating a community where they can get support.
I have a quick question. Could you all maybe share some of the signs of child abuse, maybe that adults would see who are not necessarily teachers in school districts or even clinicians?
I would say some of those signs could be a lack of sleep. You could notice that they may not be getting proper sleep. They may appear malnourished, depending on what type of trauma they're experiencing. They may be either sexually active or knowing language and behavior that is not normal for their age. What other things could you think of?
I would also just add in terms of the anger and the silence, because depending on the gender of the person, their reaction to the abuse can present very differently. And so we want not only, parents, just the average person to understand when you have a child who's maybe very withdrawn, or a child who has been able to meet a number of milestones in terms of, walking, talking, socializing, and then all of a sudden you see this child who's maybe using baby talk instead of talking, or maybe all of a sudden starts wetting the bed, those kind of things, because we know that it automatically impacts the development of the child. So you will see some regression in terms of those development. And then again, as I mentioned, in terms of gender, sometimes we see, aggression, the fighting, the biting, the kicking. You may, in some settings consider it like bullying. And so oftentimes those are ways that children are really trying to find their way and hear their voice. And, again, it can be damaging to others, and which is why it's so important to ask those questions and really just be there to support a child when they are demonstrating those kind of behaviors.
And I think one of the other things just about being a therapist with New Generations is the different methods of services we provide and the interventions. So a lot of times people are not so aware of what to ask for when they're seeking therapy. I know trauma-informed care would be really big for those who have dealt with different types of abuse. And I think with New Generations, because we're able to be in the home, we're able to be in the school environment, we have office settings, and we provide services outside. So if there's kids who prefer going on nature walks and it helps them express themselves, I think that's one of the great things just about what New Generations provides, but also what we can give the schools who may not know what to implement in their setting. So if you have, if your child is in a classroom and they've experienced trauma and you're aware of the trauma, but you're not able to express that to staff, then at least expressing to staff, are there accommodations that we can make for the child? Is there a sensory room? Is there an art room or playroom? What can we do to help this child navigate through their classroom experience, since that's ultimately where they are for the majority of the day? So how can we create balance within their home life and their classroom life so that they're able to navigate it, in other environments that they'll flourish in, really?
And I think that for the younger children, that's absolutely correct. And I think as, excuse me, as a person continues to develop, I think that some of those same type of interventions and strategies you mentioned are appropriate for older children as well and older adults, because we all need to be able to use some creative juices that we have and to express ourselves in so many different mediums and opportunities to be able to do that. Again, as I said, I think that it's really important for us to talk about how this abuse, child abuse, impacts on adults. And again, I think that we mentioned earlier how their relationships, how important it is to have relationships, and how unfortunately so many adults really struggle with having healthy relationships and being involved with risk-taking behaviors that unfortunately will result in them not having connections with others, maybe having unfortunately ended up incarcerated, addicted to drugs, have other kind of addictions because of these behaviors that have not been addressed, and for many people not really wanting to openly admit that they have had the abuse in their lives and not knowing where to seek that help from. So again, I think we need to really think, even though we say prevent child abuse, but I think we really need to focus on, again, as we talked about, the lifespan. That is not just a child, but a child grows up to be a young adult and an older adult. And if we don't address those issues, they carry on throughout our lives, and it impacts on the quality of our life and the decisions that we make, and ultimately on our health. We know that if we have had some adverse effects when we're younger, it impacts on whether we have medical issues like maybe heart conditions, diabetes, hypertension. All those illnesses are often triggered by those health, by the abuse that a child has experienced and has not really dealt with, and so it really manifests in our bodies, and it comes out in ways that we end up really impacting our wellness overall.
Especially that, with just unaddressed, the trauma that's not addressed in adulthood, mentioning like the attachments. So individuals who are not aware of, their anxious attachment, avoidant attachment, dismissive, they're fearful of certain environments or maintaining the connections that they have. A lot of adults begin to self-abandon themselves, or stemming from codependency or needs to people please, and having a lot of unhealthy, emotional, immature connections. I think having seeking out some kind of support, even if it's like online groups or finding, community programs that's in your area, just so that you have a safe space to go to. You're able to express your fears, your worries, you're able to express your goals and what you want to accomplish, and that you may not know how to get to that point of accomplishing it, but you know that it's something that is necessary for you to do. And even speaking on what you mentioned, like medically, just a child is more likely to experience depression and anxiety, which leads into their adulthood. And a lot of times adults may not be aware because they have to work and they have to go to school and they have to manage responsibilities. And so they may, put aside whatever feelings that they have that may have stemmed from said trauma. Which is why I think journaling is great.
And I think, again, once you become an adult, and if you haven't dealt with these things, it really becomes generational, because now these same adults are now going to be parents. And so they don't necessarily have the skills or know that they have to, that they need those skills in order to really address their children's needs emotionally. So again, with the help of therapy and creating a community of support, that not only helps the individual, but it helps the next generation.
So ladies, a closing question for you both. How can we as adults help those who have been abused as a child, either whether as children or maybe as adults in our lives that we either work with or that are a part of our families?
I would say creating safe spaces for others to feel heard and seen. A lot of adults who are going through the phases of even codependency, it's primarily because they may have been, they have lacked the affection or the nurturing or the compassion or validation. So I think giving someone a space to feel heard, maybe, helping them with resources. A lot of times someone could be dealing with depression and you may not be aware. So just asking if they need help, with groceries, or asking if they need help cleaning their space.
I think also having a non-judgmental attitude. I think that when you create an environment where people feel as if you are supportive and with no judgment, and that you're willing to assist without necessarily invading their space, but also respecting their privacy, along with being able to provide them with resources. And I think that is, I think Chris 180 is an excellent resource for not only adults, but children, families, just the whole community, because we do have a number of services and programs that can create a community for those who are looking to have a safe space for themselves.
Thank you both so much for sharing your insights today. And as a reminder, Chris 180 is here to support you. We are providing counseling services for children all the way through adults and families and anyone who's experienced trauma in their life, whether as a child or as an adult. But if you have seen someone who may have signs of child abuse, please reach out today. You can call 1-855-GA-CHILD. That's 1-855-GA-CHILD. Thank you so much for joining us, and we look forward to seeing you